Hi everyone, it's Matthew McKenzie back again. I promote and raise awareness of unpaid carers, particularly also those caring for someone with long-term serious mental health or severe mental health needs. Also raise awareness of those caring for someone with cancer. Also have a focus basically as well on minority unpaid carers, and this sort of session, this video that you're about to see now, is again focusing on that. I do believe, especially in this current climate, there needs to be a focus on minority groups who often struggle for support, especially when it comes to support on their own health and well-being. So, on this particular topic, as you can see from the title, I want to basically focus on why it's so difficult for unpaid, I would say, Black carers to struggle to access mental health support. Not being biased in a sense, I'm certainly aware that this is extends to the focus of unpaid patient, unpaid, let's say, families who are caring for those already using mental health support. But we can't really neglect that carers, I'm not saying just Black carers, but carers as well from all races do struggle with their own well-being and mental health support. And again, this issue um, can't always be easily picked up. There's not many resources on it. So I'm trying to add to that resource. So let's look at why Black carers struggle to access mental support in the UK, and specifically focusing on the UK is where I'm from. In the UK, there are significant challenges to accessing mental health. Those The mental health system, in its sense, is struggling with resources itself, but there are actually further struggles when it comes to Black carers seeking support for their well-being and mental health. And this is, again, we cannot ignore there are systematic inequalities, also cultural stigma, financial barriers, and a lack of culturally competent services. We'll look at each in detail going forward. There also are issues where that create that situation. Now, when you're in a caring role, when you're caring for someone long term who's struggling with long term ill health, it can present itself in Black carers as burnout, especially as I mentioned before. There are challenges with the mental health system, with the health system, with the social service system. And I'm particularly focusing on mental health support for now. So if you care for someone long term, there is risks, and it can actually lead to burnout, anxiety, depression without that adequate support. Now, I'm going to go into the key reasons that I've mentioned before, and just in a bit more detail about why Black carers actually struggle accessing mental health support in the UK. So look at these systematic inequalities in mental health services. Basically, there is, as mentioned, a struggle in resources regarding those services. We can actually look at disproportionate underfunding, where Black communities are just less likely to have that local tailored mental health service support for their needs. Public mental health services, such as those provided by the NHS, they are, as I said, overstretched. There are currently changes now, as I speak from this video, looking to resolve those issues, but it's been many, many years those services are being put under strain, and it actually discourages Black carers from seeking help looking at those services. Continuing on with those systematic inequalities in mental health services, being introduced to those services isn't a pleasant experience in regards to these two things I'm going to mention, over policing and misdiagnosis. So, and it's not just knee-jerk responses. There has actually been a lot of studies, and I'll perhaps cover those in another video. But it does show that Black people are more likely to be misdiagnosed with severe mental health conditions, and that they're less likely to receive those early interventions. So instead of receiving supportive therapies, like um, perhaps tailored support to increasing access to social therapies or psychotherapies. Black individuals are they disproportionately subjected to coercive treatment, isolation, restraint, and forced hospitalization, counted to the Mental Health Act, which is one of the reasons, or many other reasons as well, but one of the reasons the Mental Health Act was looked at and revamped. Now, continuing episodes and history of this misdiagnosis and how Black people, Black carers are introduced to mental health does eventually foster mistrust, which is still ongoing as present as of this video, which is again why I'm trying to raise more awareness of this, because I do really want minority carers, Black carers, to actually trust the mental health system. But as it stands, there is distrust of that service, of the system. And when you have distrust, you do begin to be hesitant to seek help and support. But there are other reasons as well, which I'll go into. We cannot ignore the importance of culture around mental health and seeking support. Also, we cannot ignore that there is stigma in mental health, and I'm going to quickly go through why these have an impact when it comes to seeking support in mental health, especially if you're a Black carer. So there is that narrative in regards to family, especially Black men, in order to be strong and endure hardships without complaining. Seeking therapy, and I will repeat this again, for Black men is often seen as a weakness. There will be peers that will criticize you even when they don't fully understand the importance of well-being and mental health, especially if you're struggling with your well-being and you're struggling providing unpaid care. And that can lead to silence and lead to stigma. We can't also ignore that there are religious and spiritual barriers as well, which adds to even more pressure when you're trying to seek support for your own well-being. So obviously, when you're struggling with dealing with life consequences and your caring role, people turn to faith. Black carers turn to faith leaders for support. And yeah, that's fine if you're having to use religion and faith to help you get through. I've got no criticisms of that, but if that's the only thing that you're going to turn to and still not focus on importance of mental health, there can be problems. So it's not just church, it's not just mosques, it's not just other faiths and spirituality. We have faith in those leaders. They are a trusted source of community guidance. There are risks with this because it can unfortunately lead to belief that mental health issues should be resolved through prayer alone, delaying professional intervention. Now, I know that as currently as I speak, I am observing mental health services work with their local spiritual leaders out in the community. This is absolutely crucial in order to combat cultural stigma and challenges faced in the community when it comes to faith, spirituality, and religion. It doesn't have to be professional mental health services from the outside. It can be worked within those spiritual settings. Although I'm sort of rushing ahead with myself, this is something I will perhaps look into later on during the video about how to combat this sad story, these issues that I'm raising in the video. Continuing on, we've got a lack of culture, I would say, appropriate support with the mental professionals. So there's actually underrepresentation of Black therapists. There is, unfortunately, a focus on, let's say, Eurocentric model when it comes to working with Black community, Black carers. So, yeah, there's this, it's not just to focus on Black carers. I'm not sure what is needed to get more minority groups into the mental health profession. So there is at least some form of relation, because if you're going into a service, there is risk that you may not feel understood or represented in therapy. and there's a risk that instead of receiving that therapy that you would want, people get tired, they jump into bias and rush conclusions, and there's a focus on just medicalization. So there's communication issues, language barriers, misunderstandings in culture, um, belief. We do have, and I'm not just being knee jerk or being racist. There are studies there where, I'd say some, not all white therapists, but there will be those that will not fully grasp the cultural and racial experiences that are shaped by Black carers' stress and trauma, and again, mistrust of the services. As of this current climate, and throughout history, there is a problem of racism, and this extends to many areas in the UK. One of them obviously being healthcare. Um, with mainstream therapy approaches that may not acknowledge the focus on racial trauma. Now, listen, racial trauma can be well hidden. It's not easily exposed and can be easily dismissed. And once it's dismissed, people give up. They just don't have faith in the system. They just don't have trust and believe that they'll just be ignored. So when Black people express stress linked to racial discrimination or prejudice, it sometimes can be dismissed as an overreaction, paranoia. And eventually, over time, it will discourage them to continue seeking therapy or even having therapy, which is even more of a tragedy because there was distrust in the first place. Leading into financial support, there is an issue when it comes to private therapy. Obviously, you're stuck between a rock and a hard place. So yes, we have to admit the NHS is free. It does amazing work for what it can do with its resources. But waiting list, we can't really ignore. They can be months long, for obviously forcing many to seek that private therapy, especially if there's that distrust factor as well. Now, last that I've looked, I've seen private therapy costing between £40, 100 per session, depending, what your local area is, what's available. Now, we have to also note that there is severe financial pressure in the private areas, not having, Black carers, minority carers, global majority carers looking at that cost. They're not really going to go for that kind of support because of the cost, especially if you're coming from a low income household. And also, if you're providing long-term unpaid care, there are time constraints to this. There are actual caregiving demands. So if you're even working as well, whether it's full-time work, part-time, and with care responsibilities, it's going to be leaving little time for self-care. I've always often said to many other carers out in the field, you must try and seek time for yourself. Not easy, obviously. I'm aware, especially during a crisis, you're just going to put your loved one first. That is the nature of the unpaid caring role. So I leave little time for trying to seek those therapy appointments. There's also lack of that flexible access to accessible mental health services, especially if those may be provided during the evening or if there's virtual sessions. Virtual sessions actually give their own um, challenges if you struggle with online technology, something that's very important coming in the future regarding support for unpaid carers. Now, going back to fear of social services and child welfare interventions, again, this is not just me saying this. There has been research, and there's still ongoing research now in regards to distrust of authorities. You see, Black families in the UK, there's been a history, and again, I point to research again, a history of disproportionate child welfare interventions. Again, creating fear. And when there's that fear, there's that delay in seeking that mental health support, which could actually help in regards to black carers, but then when social services do become involved, there's distrust of them as well. So again, you'll have the sad situation where black carers will avoid seeking support to prevent being perceived as unfit for their role as parents or guardians. Considering there's also a shrinking support for safe spaces because you're under constant scrutiny, um, constantly being judged or misunderstood when trying to access those mental services. It makes black carers reluctant to open up about their struggles because they will feel they're being ridiculed, judged, misunderstood. And then again, you're looking at a system that does unfortunately have forms of discrimination, forms of racism that will actually be targeted at minority groups. So the lack of, you know, black-led mental health initiatives, so I did a typo there, means that there are unfortunately few spaces where unfortunately carers can share their experiences without fear of being judged or ridiculed or told to be quiet or just to get out. And this happens, happens far too often. It's happened to myself. And one day I'll tell, my story about, how these things impact in the community. So I've pointed out, at least five main issues. There are more, but I'm aware to try and keep this video short. We're going to actually now look at ways that can be tackled. I'm not saying they're easy though, but that these things do help. So the first thing I would say, obviously, and it's not just me, and many others are saying this, I'm just repeating the message, is to increase culturally competent mental health services, more black therapists, more mental health professionals being encouraged to work in the system, creating new ways to engage with the community. They should be recruited, trained to address cultural and racial trauma. We also need to look at the health service and also the private therapy services, even if there can't be a focus on black therapists, more diverse, those coming from diverse communities to help with that training. They should at least offer culturally sensitive approaches, including recognizing the impact of racism on mental health. Not the best picture put in there, but put in a more acute setting, but it still remains we do need more culturally competent mental health support and representation in that. And this includes leaders as well in those fields. Looking at community-led initiatives, we do need, again, Black-led mental health organizations. I give examples here. Black Minds Matter, Black Thrive is another, Race Equality Foundation. I've picked out also some local initiatives. Obviously, we've got some Haringey, Mind in Haringey, that should receive greater funding and support, especially if they're working in a climate where it's easy for voluntary third-party groups to struggle in engaging with the community. There's forever a cut in funding for those services. The other bit I've mentioned before, I was rushing to give my thoughts on, how things can be tackled, but again, the focus on reaching out into spiritual communities, church, mosques, cultural centers, they can be equipped with mental health training, but we can't just expect them to do that by themselves. We do need mental health services. We do need those that not only want to work with them, but also learn from them, learn why there is um, stigma, and also tackling the bad apples. I'm not saying that it's all mental health services' fault. There are situations in spiritual communities where faith leaders are not being truthful about well-being and mental health. They might even dismiss mental health. So we need to work with the community to educate, why well-being and mental health support is important. Looking at now the financial aspect, that is impact on Black carers, there needs to be an increase in funding, for free low-cost therapies, specifically for carers as well. We can't always look at what's been provided for those that are not providing, the caring role. We need to work with the millions of carers out there. This also includes Black carers, minority carers, and also the focus on workplaces. I did mention before that there can be a time issue, especially if you're working. So in the workplace, there should be mental health support for Black carers, including, let's say, give an example, employment assistance programs and paid mental health leave. And I know there's a lot of work being done um, for paid leave for unpaid carers. So this can't come at a time sooner. We do need that support now for those working, want to stay in the workplace. Continuing on, reducing that stigma. So there should be campaigns that help really normalize mental health discussions. And unfortunately, not only is there a racist climate out there, unfortunately, I'm seeing during the climate a focus on stigma, increasing stigma and shaming those struggling with mental health. So these campaigns have got a lot of work to do, but there needs to be more and it should be promoted. There's also a need for more trusted public figures and faith leaders that can actually break the silence by speaking openly about mental health. Remember what I said before, unfortunately, there are situations in religious spaces where we do have those that do not bring importance into mental health and well-being. They may dismiss it. So to counter that, there are those that are in those religious spaces that are trusted by the communities that will want to work and that they have a knowledge and belief about the importance of mental health experiences, which again can filter or trickle down in the community that will lead to those trusting in mental health and seeking support earlier rather than being introduced in a stigmatized way. Now, I work in this profession where it comes to computers and digital support. But I did mention earlier on that if we have situations where Black carers can't access that, then there needs to be more online therapy options, helplines, culturally tailored mental health apps, especially what we're having from the NHS with the NHS app. Absolutely vital for Black carers to seek support through there and being referred to therapy options through that app. It also needs to be free digital resources and self-help tools that should be made available to unpaid carers who really can't afford or even access therapy. So my final thoughts on this, as it stands, Black carers in the UK face systematic and cultural barriers when seeking mental health support, even many without the help they need. So addressing these issues, and there are a lot more to this, but some of these I will cover in other videos. We have to address those issues, and it does require action at multiple levels. This, as I said, include policy changes. There's a lot happening out in the field. Increased representation in mental health services, and the community has work to do as well. We can't just expect mental health services to step up. There needs to be engaged community leadership as well. Not easy, but it's something that will help in the community in the long run. I'd like to say anyway, thank you for watching my video. If you do like the video, give it a like, subscribe to the channel, and I hope to see you again soon. Thank you for watching.